I also like to invite the head of pediatric cardiac surgery of NICBD, Associate Professor Dr. Jahidul Islam, sir. Sir, please come.
Assalamu alaikum and welcome all to these sessions. It's 2024, but it is not mistakenly placed 2022 because in 2022 it's very much a popular year for the World Cup where the dream is fulfilled by the Argentinian teams to achieve their World Cup. But my favorite is this number, it's 974. It's not just a number, it's the country codes of the Qatar. But most importantly, it's not only the country code of the Qatar, it's the name of a stadium, that's Stadium 974. The world's first durable, replaceable, easily dismantleable stadium prepared by ship container. So for the search of such type of conduits used for RV2PA, I will be in next few minutes talk on revolutionizing of RV2PA travel with instantly prepared Handsewn PTFE valve conduit. I am Dr. Azad, welcome you all on behalf of National Heart Foundation Hospital. So before starting the main presentations, if we observe the timeline, there is two timeline is very important for revolutionizing the RV2PA conduit. In the first era, we are searching these conduits from last 60 years. First, the Rostelli, after that, the homographed and then Hancock. So, at least nowadays, the homographed and the Hancock valve is persisting in the market. On the other decades, we have got the Contegra conduits and the Handsewn PTFE valve conduits. Still, these are the emerging conduits, and this outcome is very satisfactory. So, these four things are still persisting in our market for the RV2PA conduits. Why we need RV2PA conduit? There are some situations in the congenital heart disease where there is lack of continuity between RV2PA, and in some of the scenarios there is very difficult to reroute these RV2PA connections without using any conduits. So these are the common diseases in congenital heart disease that needs RV2PA conduit, but I will want to keep aside the TJVS because now they have a good techniques of surgery that by which we can avoid the conduits. So these are the basic three diseases that needs conduits for RV2PA for making connections. So what should be the choice of conduits? That's a point of matters. We should not compromise with these five factors. The availability, the cost effectiveness, RV2PA distance should be maintained by the appropriate conduits, and there should be needed any minimum interventions, and durability. Definitely we should not consider with this one. So the homograph till now is the best one, but the processing of procurement of the homograft from the donor to recipient is a very cost investive procedures, and that's why we have no bank and no such type of homograph in our country. So we could not dream about these ones. We can dream, but at this practical moment it is not very much possible here. So we have to focus on the quotations of Dr. Rostelli. Science is an act of love. From that point of view, we have to focus on these things, and we have to invent different type of conduits which is durable and needs less interventions in future. After that, the final revolutions we have is RV2PA conduit made of PTFE tubes, and within the tubes there is a thin PTFE for cuffs. But if you observe the table of calculations of the different conduits and their measurements, this is very much cumbersome to memorize, and especially during the operations room to think about this and calculate for preparing a perfect conduits. So let's make it much more simpler form. So if we use a Contegra conduits, and if we have a tricuspid valve, and if we think this is a cuff, what should be the appropriate measurement of a cuff? So height of the cuffs, this is the height of the cuffs. It should be at least 70% of the length. And what should be the length? In case of bicuspid and tricuspid valve, the 3 times of the half of the base, the 3R or 2R should be the conduit length for bicuspid or tricuspid. And the most important thing is the height of the commissures. So we can memorize this way the height for the commissures in for a perfect specific cusp commissures. And the other one is fan. So if we memorize these 4 things, we can easily calculate the conduit's cusp measurements to build up a good coopted and good cooptations of cups and valve conduit. Let's go to the operations rooms to prepare instantly Handsewn conduits. During the operations rooms, one team is busy with the patients, put the patients on the heart lung machines by step cannulations techniques. And at the same times, another team is preparing a sterile trolley to prepare a Handsewn PTFE conduits in the same operations room instantly. So how we are preparing our conduits in the operations rooms? At first, we have to take your conduits, your precludes, and other instruments to prepare conduits. Let's cut an appropriate length of a conduits. On an average, if we take at least 10 centimeter length, that is quite appropriate for a conduit length. So let's take a length of a conduits measuring its tissues. Then cut it, and then we have to invert this graft inside out. Why? Because after putting a cups on the wall, again we have to invert it back, and then the cups will be within the tube. Now the most important things, the cusp measurements by 0.1 millimeter PTFE. The height should be 0.85 into diameter into PTFE conduit diameter, or the 70% of the length. After taking this one, wrap it around the conduits, and then make it a tri-leaflet cusp. The most important thing is, after making a tri-leaflet cusp, you have to tailor it perfectly, keeping that commissures, keeping that appropriate height, and keeping that appropriate length. And this tailoring should be a masterpiece. Otherwise, this measurement that we have calculated will be distorted, and your conduit will not performing well after putting it. So now our cusp and our conduit is ready. Now we have to stabilize the conduit before suturing, so we can suture it on the conduit very properly and smoothly. At first, we have to fix the commissures with interrupted sutures, all three commissures, because these commissures are the main point of a hinge which make your valve much more competent. So you should not compromise on it. After fixing up the commissures, we have to suture the cusp through and through on the conduits in a continuous suture manner. And whenever it is completed, we have to invert graft outside in to put the valve within the tube. And now this is a tri-leaflet Handsewn conduit is ready for use. So we have, if you want to share, if I want to share this our experiences, we have used both Contegra and PTFE conduits in last 6 years, almost 22 cases, and among them you have found most are predominantly less than 5 years. Gender is almost equal. The dominant disease are the pulmonary atresia, followed by LAD crossing RVOT and truncus. And if we compare the percentage of the use, now we are using Contegra more, PTFE handmade conduit more. And if we compare the Contegra and conduits, the competency of the valve is almost similar and good enough in Handsewn PTFE valve. So what should be the surgical considerations before putting a valve made Handsewn tube graft in operations room? The appropriate size, the siting of a PA and RVOT incisions, perfect lie should be there, and a good curve and hood should be there, and that should be very much important. So if you observe this video after putting this graft here, there is a perfect length and lie, there is no kinkings, and there is a very perfect hoods. So that is the main point after replacing the conduits on a heart and after removing the CPB. So if we go to the literature reviews, 3 large literatures, depending upon the different one. The first one, the evaluations of the homograft for 20 years. The second one, the evaluations of the Contegra for its outcomes in long-term period in comparison with the homograft. And the last one, the PTFE valve conduits. So our motto is to minimize the interventions. You know, the Contegra have 5 years interventions is almost 20% less, and 65% is 10 years without intervention period. But these two matters long because these have a very good quality. Intervention rate is very low. Who are these? These are one is Contegra, one is PTFE conduits, and another one is homograft. So definitely the Handsewn conduits have a good options for us, our such type of developing country where we have no bank for this one. So we should choose this one in our country. So for my take-home message after these few slides, these PTFE valve conduit have less than 8% re-interventions in the first 5 years, and availability and lack of potential sensitizations makes PTFE valve conduit an appealing alternative to homograft conduits economical advantages without sacrificing the surgical result. And the last thing is still we're searching for the best conduit. So with all, thank you. Thank you all.
Thank you, speaker, for your very informative presentation. Now it's question answer session from our